Hi everyone, my name is Dr. Melissa Estavillo. Welcome to Biltmore Psychology and Counseling. For the month of May, we're talking about different modalities and types of therapy because a lot of people have questions about these things. They read about EFT, EMDR, CBT therapy, and those are just weird acronyms and don't make any sense. And so we wanted to be able to provide some of the information so that you potentially knew what you were getting into if you were stepping into therapy and this is what was being offered. And so one of the, I would say, potentially newer types of therapies is something called EMDR, and it's eye movement desensitization and reprocessing. And so a lot of these therapies came out of the growing understanding that when we've been through something traumatic, when we've been through something very anxiety provoking, our memory formation is really unique in those situations. We find that we can kind of have these like crystallized memories that are really fresh and vivid and overwhelming and can lead to kind of a flooding sensation where people feel very, very anxious. And as a result, it feels like there's many places where they try to avoid those type of circumstances so that they're not triggered, so that they're not overwhelmed. The problem with some of these traumatic experiences is that when people start to talk about them, it can feel like they're reliving it again. It can feel really vivid and overwhelming. And so EMDR is a modality that helps people ground themselves in the moment, stay calmer as they're reprocessing some of these memories. So there is science behind this, I promise, but the thought is when you are thinking about a memory, when you're able to watch someone's fingers, you end up using different parts of the brain to reprocess the way that memory is formed. There's also some evidence that shows that that can be a really grounding, calming experience so that the amygdala, the fear center in the brain, is not quite as triggered up. But the end result for a lot of this is that people are able to face some of these memories, face some of these maybe larger conceptual worries with less anxiety and less distress. And so this is a really, really cool technique that a lot of people are trained in to be able to help embrace some of those traumatic memories without it just feeling like you're just kind of like raw and open and exposed and reliving some of these things. And so within our office, we do have a resident psychologist that does this all the time. She has advanced training in this. Her name is Dr. Sherry Clark, and she's very passionate about it. Hopefully we can get her on video to be able to talk about some of these things. But as always with these are kind of like larger, complex types of concepts, so we'd love to be able to answer any questions that you have. So as always, leave those in the comments below, and we'll be happy to answer them. Thank you.